Hi, my name is Alafia Samuels, and I'm the director of the George Alene Chronic Disease Unit. Sorry. Hi, my name is Alafia Samuels, and I'm the director of the George Alene Chronic Disease Research Institute, which is part of the Caribbean Institute for Health Research at the University of the West Indies. I'm also principal investigator of the IDRC-funded evaluation of the Port of Spain Declaration and its follow-up study, which is called Improving Household Nutrition Security and Obesity in the Caribbean Community. So in 2007, the Caribbean community was the first in the world to convene meetings of heads of government to deal with the question of NCDs. Out of that meeting came the Port of Spain Declaration, and the university was asked to conduct a formal evaluation of how well the country is implemented or not the mandates from the heads from the Port of Spain Declaration. So we concluded this in 2014, and in summary, our findings were that the weakest areas were in diet, schools, and communications. So in 2018, the IDRC funded a follow-up project to the Port of Spain evaluation and to a former project called Farm to Fork. And what we're interested in seeing now is how can we most effectively improve dietary diversity in the populations of the Caribbean? So in this project is quite innovative in that there are areas that we have not yet determined exactly what we're going to do, because the plan is that in the first year we would engage with stakeholders in the public, private, and civil society to determine what their perspective of the food system was, to map this food system using systems dynamics, and then to ask them what they thought were the correct interventions. We have done this, and then we met with a high-level project advisory committee, and we have concluded that we are going to intervene in 3 areas. One is the area of childhood feeding and school meals, and how to engage children in determining what are some of the correct solutions to the childhood obesity problem. We are also working with the Caribbean Examination Council, which will be setting a new curriculum and exams for students in the Caribbean, and we will now include chronic diseases, their risk factors, and the drivers of the epidemic. The second area that we wish to be working in has to do with technology and the use of technology in the school curriculum and communicating with the children using new media, social media, and so on. And secondly, to use technology to connect the producers of healthy food and the buyers of healthy food, using apps and things like that to help the communications, to make the transfer more seamless between the producers and the buyers. The third area we're going to be working with has to do with engaging with what we call the friendly private sector. There are members in the private sector now who are making good profits selling healthy foods. We have identified these members. We hope to use them as case studies. We hope to use them to demonstrate to the other members of the private sector that it is possible to make profit selling healthy foods. And this is very important because it's the private sector that feeds people, not the academics. So we need to get involved, get them on our side, sort of enhance and showcase the good work being done by some members of the private sector who are committed to healthy eating, and to use this to spread the message through the region and improve the dietary diversity of our populations.
Importance of implementation is that?
So this project really is an implementation project. It is really not research, and we have had some challenges with some of our colleagues in universities who have a little bit of a challenge in recognizing that implementation and research are not the same thing. So you implement, and of course you're going to monitor and evaluate, but it is not about a research project. So it's very important that in this second project from IDRC, we are concentrating on translation. So we did the first project, we got results, and now we are proposing implementation and activities to translate the research findings into having impact with populations on the ground. Because in the final analysis, it really is what the populations think, what their attitude is, what their pattern, their dietary patterns are that are going to change the NCD epidemic in the Caribbean.
Perfect. Thanks so much.
Okay, thank you.